In this video, you're going to learn how to correctly and safely perform lid hygiene for your newborn baby at home if they're suffering from a sticky eye, and we'll also cover when you might want to consider seeing your doctor about this problem using advice from the National Health Service in the UK. Now, I know from my own experience that this can be a scary problem as a new parent dealing with this for the first time, but often a sticky eye is a very common problem in newborn babies while their tear ducts are developing. You might see a sticky white or yellow discharge in the corner of one or both of your baby's eyes, like you can see on screen here, and this might cause the eyelashes to stick together. This is usually caused by a narrow or blocked tear duct, which generally opens up and begins draining normally within the first few months of life. In 90% of children, this is going to resolve naturally by the age of 1 as the child's face grows and the duct enlarges. So what should you do at home if your baby has developed a sticky eye? Well, there are two important things to try to. The first is to clean the pus away, and you can do this with a damp piece of cotton wool. Now, you should use clean, cooled boiled water and wipe each eye from the corner by the nose outwards. You should use a clean piece of cotton wool for each wipe, and whilst the cotton wool should be wet, try to drain off any excess water before starting so it doesn't run down the child's face and irritate them. You should always wash your hands before and afterwards, and you may also want to do this after your child has fed so that they're as calm and as settled as possible. The second thing to do is something called a tear duct massage. Now, to do this, use a clean finger and apply gentle pressure on the outside of the nose near the corner of the eye, rubbing down 3 to 5 times. Now, you can do this twice a day if needed, and you should be gentle when doing this. If the tear duct is still blocked and continuing to cause a sticky eye by about 12 months of age, then you should see your doctor, who may refer your baby to see an eye specialist. I've also made a more detailed video on this, which is also elsewhere on the channel, so please do check this out if you think this will be useful for you. Finally, when should you consider seeing a medical professional or getting attention from a medical specialist if your child has got a sticky eye? Well, of course, this is going to vary depending on your child's case, but here are 2 tables from the NHS which advise when you should seek medical attention if your child has got a sticky eye. There are important things in both tables, so please do take time to review these. As ever, I've included much more information in the information section of this video, so please do check this out if you're interested. And also, if you do have any concerns or questions, please consult your own health provider, who will be more than happy to assist you. Once again, thank you for watching. I hope you found the video useful, and until next time, bye.